Hello, everyone, and welcome. This is the You and Jonny Blue podcast, episode number 9. I'm really excited today. We're going to talk to a physician who's going to give us the most current and up-to-date information on the coronavirus. With all of the different sources out there, sometimes it's hard to know who to trust, but also things change so quickly that even accurate statistics or data that we had a week ago or a month ago don't really, they may not be accurate anymore, or things may have changed. And so I thought it'd be really cool to get some information about how it's been on the ground floor in the emergency room and in the hospital. And so joining me today is an emergency room physician who works at the Loma Linda University Medical Center and teaches in the medical school, teaches residents in the clinical setting as well. I'm really excited that he's here. His name's Dr. Brian Savino. Dr. Savino, thanks for joining me today.
Dude, thanks for having me.
Hey, you're welcome. So before we get started, I want to ask you about how things have been going with the coronavirus and get some data from you in just a minute. But a quick housekeeping note. Is it true that ER doctors would prefer to be called ED or like the ED department instead of the ER?
So there's some ER doctors who are like really, I don't know, they get really hung up on that because they don't like the idea of people thinking they just work in like a single room or something. I don't know.
Like a ER, like the emergency room.
So instead of emergency room, they like the idea of emergency department. It makes it sound more official. And so, some ER docs get offended with like the emergency room, but it's kind of like everybody knows what you're talking about when you say ER, so it doesn't really bother
and the
me.
problem is people don't necessarily know what you're talking about when you say ED. Like, as just a common person, when I hear ED, I think of erectile dysfunction.
Yeah,
And
that's a great point.
yeah, so I was not going to associate Dr. Brian Savino's name with the term ED.
I appreciate that, actually.
Yeah, we don't want to get it. We don't want to get it twisted here.
Hey, you know what? What really matters is your intentions, and so I appreciate you not associating me with that.
Always pure, bro. And
Thanks.
when I say bro, I mean that with the highest level of respect. All right, Dr. Savino, let's start with this. Do we still need to be afraid of the coronavirus?
I don't think I'd use the word afraid. I think I'd probably use like aware. I think you still need to be aware of the coronavirus. It's still affecting our society. It's still out there. It's still infectious, and it could still be really dangerous for, people you love, especially people who are older or have a lot of medical problems. And I mean, we do see some young people get really sick from it too. So for the vast majority of people, it's not something you need to be afraid of, but you do need to be aware that, life isn't, back to 2019. There's still things we need to do to kind of protect ourselves and those around us.
Okay. But this is, and so my next question is that different from the way we were thinking about this initially? Because initially it was something that most people were afraid of. And that is probably what was the impetus behind everybody actually following the rules so closely. Everybody wearing masks, everybody staying at home. I was even surprised to see how many people were actually following these rather drastic steps. And I think a lot of that was because of how scared people were. And so I guess the question, though, is, do we need to still maintain that same level of, I don't know how to say it, diligence to following these really strict guidelines of social distancing, et cetera? Or can we see our parents now? Can we kind of hang out with our next door neighbors and barbecue, and be following the rules a little more loosely?
I think we're kind of at a point where, if if you know somebody who's close to you who has, some kind of immunocompromised state, or is much older, or has certain comorbidities, like, that they have bad heart disease or bad lung disease, or, they're on medications to lower their immune system for one reason or another. they're probably not people that you want to be in close contact with, interacting with. I think, people in your same household, it's almost impossible to socially distance from them, right? You're gonna be in close contact with them. Um, I think being out in the world, when you're out in the world walking around, we've, we have kind of confirmed that this virus can be asymptomatic in a lot of people and that those people are still infectious. And so maintaining those social distancing when you're out in public, I think is still important. Wearing a mask in public, because honestly, you're not going to know if if you've contracted it, if you're an asymptomatic individual, and wearing that mask can keep you from spreading it to others. It's not going to protect you from getting it from someone else potentially, right? So being responsible in that way, I think would do, if we could show as a society that, we could be responsible in, maintaining social distance from people, wearing masks, using good hand hygiene, doing all of those steps that have already been shown to help prevent the spread of the virus, then I think we can, really look into opening things up a little bit more, and going out into society and, interacting a little bit more. But honestly, it's not going to look like how it did. It's not going to be, for the foreseeable future, the idea of, a bunch of people crowding into a packed bar, and just having a great night with, 100 people in a small space. I don't think we're anywhere close to there yet. I think we're still, needing to be in settings where there are, open air, space between people, and potentially wearing masks too.
Okay. So like this morning, my friend and I went to go surf together because they opened the beaches. And 2 weeks ago, if we would have done that, I would have said at the very least, let's take separate cars and I'll meet you there. And this morning we rode in the same car and we don't live together. And that is because I feel more relaxed about it.
Sure.
And I'm not sure that that's good or not, but based off of the way things feel like they're going for me, to me, it seems less serious to me personally. And it seems like it's less something that I should be like, I'm okay, like kind of flexing the rules a little bit with the social distancing. Like I'm cool with riding in the same car as my friend. Is that okay? Or would you still recommend against that for me?
I think there's two separate issues, right? So the first issue is your personal feeling of risk, right? Like how afraid are you personally of contracting the coronavirus and having a really bad outcome from it, right? And for you, Jonny, with a young, healthy guy that's otherwise active, the likelihood of you like ending up in the hospital even with coronavirus, if you did contract it, it's very close to zero, right? Like you personally are not going to be or have a very low likelihood of having a bad outcome from coronavirus. So there's that part of it, right? And so from that part of it, I'd say, yeah, I mean, people have to make their own risk calculations, right? On the other side of it, there's kind of the population, public health side of it. And that's, okay, so Johnny Blue gets the virus. Johnny Blue is probably going to be okay. But who else is Johnny Blue going to come in contact with? And will those people be okay? Or let's say Johnny Blue comes in contact with a lot of people who are also going to be okay. Who are those people going to come in contact with? And how much spread are we potentially going to get of the virus with those relaxing of restrictions? And I think that is, what public policy makers are trying to figure out right now. Gavin Newsom, put out a tweet today looking at kind of this phase 2 reopening of California and what is that going to look like? What are the types of businesses and industries that are safe to open up? And if they are safe to open up, do we open them up, just say, okay, let's do it? Or do we open them up with restrictions? Are people going to need to get their temperatures checked at the door? Or are they going to have to wear masks when they go inside? Or can they even go inside? Can it only be curbside pickup for restaurants? There's a lot of these little details that I think we didn't know the answers to at the beginning. And maybe we're just now starting to get a better idea of what that's going to look like. In terms of, you riding in the car with somebody else, I think the technical answer probably is, if you don't live with that person, you probably shouldn't. You probably should take a couple cars. In terms of hanging out with that person surfing on a beach, that may be different. That may be, maintaining 6 feet, surfing, you can still, interact, talk, have a good time.
Right.
But you still should probably, not give each other a hug, you know what I mean?
Yeah.
Or
So
shake
like,
hands.
so like two neighbors maybe going on a walk with each other in the evening or something. If it's outdoors, that's
Yeah.
different than maybe like, them riding in the same car, something like that.
Yeah, absolutely. I think there's been some evidence that we don't have a lot of cases of coronavirus. I mean, we have a lot of cases, but in terms of studied cases where we've tracked them to their origin, of why people got sick, most of those cases occur in indoor spaces that are small, where the coronavirus kind of goes up into the air after someone coughs or sneezes or talks a lot, and kind of percolates in the air for a while, and then somebody else gets infected with it. It's a lot less likely to get infected in open air, right? Because there's breeze, the space is huge, you're probably moving, so the cough happened 20 feet back and you've already walked past it, and by that time it settles or blows away. So yeah, there's less risk of catching a virus that way. That being said, as we begin this process of reintegrating into society, hanging out with friends, all that stuff, maintaining those social distancing, wearing masks, all of that is still going to be important. So.
Okay. Yeah, that's really helpful. Thanks. And in just a minute, I want to ask you a couple of things. I'm curious, like what it's been like on the ground floor as an ER doctor, what you've seen in the hospital, whether it's been kind of different from what you were anticipating or whether it's been in line with what we were projecting. And if we also need to be worried about like a second wave, like they talked about happening with the Spanish flu, and some of these types of things. But I'm just curious now if we could just talk a little bit about data for all the data people out there. What are some of the the latest statistics that you've heard, and how that relates to what we were talking about previously in terms of how much we need to be worried? I know there's information like Stanford came out with this study saying that we've under diagnosed the amount of cases by like 85 times, which means way more people have had it than we initially thought. But then there's some conflicting evidence to that too. And so I was just curious what you've come across recently.
Yeah, no, I think there's been a lot of evidence coming out that we've probably way underdiagnosed the actual cases of coronavirus. There's one study I was just reading today of a homeless shelter that just started testing everybody who came in the doors, and out of like 300 people, and none of these people had symptoms, but out of like 300 of them, almost half, tested positive, right? And so there's a serious question of whether or not the cases that we've actually seen and diagnosed, whether or not that's just kind of the tip of this big iceberg, right? Everybody kind of has this anecdotal story of when they got sick, back in, end of January or February, like, I bet that was it,
Dude, almost everybody has that. And I have that too. I'm like, I think I got it already. Like I did get sick, and like everybody says that to me.
Yeah. So everybody kind of has that little anecdotal story. Still, the percentage likelihood that early on was, coronavirus is pretty low, but it's possible. I mean, it's really hard to pinpoint. We can say, who the first cases were that were diagnosed, but we really don't know who the first cases were, in the United States. Because
So
yeah.
So sorry to interrupt you, man. They said, so some of these people are saying, well, if 85 times more people have actually had it than we have diagnosed, then the people that have died from it is actually 85 times less than what were like the percentage of people that are dying versus the percentage of people that are getting infected. They're saying is way off, but is it true though that people have also died possibly from it that haven't been correctly diagnosed too?
Yes, that's really true, especially early on when we didn't have the testing, right? So, I think it is possible. It can go really either way right now, in that it's possible that the death rate is actually much lower than we're experiencing, because There's so many asymptomatic infections. But it's also possible that a lot of people who have died who have not been tested, that they could have actually had coronavirus as a precipitating cause. It's also possible, a patient comes in with a heart attack, for example. Patient comes in, has a heart attack, and dies of the heart attack. We're seeing that, okay, that patient may or may not end up getting tested on autopsy or even in the emergency room where they pass away for coronavirus, even though coronavirus may have been the precipitating thing that caused their heart attack, right? They just had this underlying medical comorbidity of bad coronary artery disease, and then they caught coronavirus and it pushed them over the edge, right? And so what we don't know is how many of those cases there are either, or people who are, just found dead in their homes who are not tested for coronavirus. So I don't think we can really say what the true death rate is of coronavirus yet. And I couldn't say right now with certainty if it's much lower than we're currently projecting, if those things kind of even out in a way, or if it's about the same as we're projecting.
Okay, because in New York, they were saying that the amount of heart attacks increased by a lot too, right?
Mm-hmm.
Or something like that?
Cardiac arrests. So people whose hearts just stopped and the EMS, the ambulance fire department had to go to their house and try to revive them. Those have increased quite a bit. And so, and not all of them necessarily ended up being tested for coronavirus at the beginning.
Right.
I think they're doing that a little more now, though I'm not 100% certain. So, so yeah, we're not sure. I know we've had some weird cases, in San Bernardino County, where I work. We've had some cases that, we maybe had a suspicion, that could have been a precipitating cause, but we didn't, or didn't have the ability to test at that time. So.
Can you describe what it's been like in the ER and just in the hospital in general? I've talked to some people, they say that it's kind of eerie. It's different. It's a lot different than they were expecting. Like some hospitals are empty and others are, like, in certain places they're, really quite tragic in terms of the too many patients. Like, what's it been like for you in your experience?
It's been, when it all first started, kind of when the news broke that, hey, this is coming to the United States and everyone better prepare. I think we saw the volumes in the emergency department go way down, right? So much lower than we're used to. And then the patients that we started to see, ended up kind of being selected for the really sick patients, right? So it felt like we were seeing a lot of sick people, but the overall numbers were really low. That's what it's been like at Loma Linda. And people and places around here. I'd say really that's the story we're hearing around the United States, except for some of the really badly hit hotspots like New York, right? New York is kind of, New York, New Jersey, that Northeast area, they got hit harder than anybody. And they really, in terms of ICU patients and really sick, patients coming through the emergency department, they're taking the brunt of this. Whereas most other places around the United States, it's not like we're not seeing coronavirus patients. We see them every day, but the volume of those patients are much less than some of the other places are seeing them.
Because one of the biggest things is our whole goal was to flatten the curve so that we didn't overwhelm the healthcare system.
Right.
And the whole talk about not having enough ventilators and all this thing was the primary reason we shut everything down, right?
Right. And I think that may have been maybe something that, like, the general public, I don't know if they really understood the purpose of flattening the curve as much as, the healthcare providers and policymakers really were talking about flattening the curve. When the policymakers and healthcare people were talking about flattening the curve, remember, whether the curve is really tall or the curve is long and fat, the area under the curve remains about the same. Right? It's about the same number of people end up getting infected. What we're trying to prevent is a hospital surge where we have people who die unnecessarily because the resources aren't there. Right? So you have, 1,000 ventilators and 2,000 patients that need a ventilator, then, 1,000 people are potentially going to die who maybe didn't have to. Right? And so that's what we're trying to prevent with flattening the curve. The problem with flattening the curve, I should say a side effect of flattening the curve, is that the curve then extends out much longer, right? So if you have this disease that spikes, you have all these deaths, all of these illnesses, all of these sick people. It spikes really high, overwhelms the healthcare system, but kind of goes like wildfire, through the community. Then in a short time, everybody has it. Your death rate's super high, but it's done in a couple months, right? Whereas in this case, if you flatten the curve, maybe this takes 6-8 months, but it's at a slower pace. The healthcare system doesn't get overwhelmed, and people who do die are dying because, we were still able to provide the best care we possibly could. They just unfortunately succumbed to the disease. It wasn't because I didn't have a ventilator for them. Right?
Yeah. Okay. And I don't want to get hung up on this because we could probably talk about this too long related to like the economy and everything. And
Mhm.
we don't want to make it political, but when the hospitals are empty, does it feel like we flatten the curve too much?
I wouldn't say that we flatten the curve too much, right? Because we're still seeing those coronavirus patients. What I worry about are the other patients, the patients that are sick from something else, like they're having their heart attack anyways, but they're too afraid to come to the ER because they're worried about catching coronavirus, right?
Mm-hmm.
Or they have appendicitis and they're too afraid to come to the ER even though they have horrible stomach pain because they're worried about coronavirus there. And like, I'll just try to, call my regular doctor and see if we can figure it out. Those are the patients that I worry about. And those are some of the things that I think maybe the messaging maybe went a little bit too far, and maybe scaring people a little bit too much. Like, I think again, I agree with the whole policy of staying home, right? And trying to flatten that curve. But I think messaging also needs to go out but if you do need the emergency department, please come, right? Please go to the emergency department and get your healthcare problem taken care of. Don't wait it out, especially if you think this is something that's a problem for you because you're afraid of catching coronavirus, right?
Mm-hmm.
Because that's very unlikely to happen with the precautions that are set up in emergency department. And it's way more likely for you to have a bad outcome of ignoring your chest pain, right? And trying to make it till tomorrow or something, right? And that's when we see just way sicker patients and problems that didn't need to happen if they would have come in sooner.
So that's something you've really experienced then, it sounds like.
Yeah, we're seeing, we see patients, who, come in and they'll report something's been going on for, 3 or 4 weeks. And we're like, well, I wish we could have gotten to you 3 weeks ago.
Okay.
Because, this has now ended up progressing farther than it needed to, so it'd be a really big ask, I think, of everyone in the emergency department community that if you got a medical problem, don't stay away from the ER just because you think you're going to get coronavirus. If you're worried about something, get your medical help. You need it.
Okay. And what's it been like for you personally? I've seen pictures people posted to Instagram, and I've seen pictures actually from you specifically where, at the end of your shift, your face is like almost bruised, from wearing the protective,
Yeah.
the PPE equipment.
Mhm.
What, I know the ER is like just always a stressful place. I mean, you're seeing the most acute and the most urgent needs that exist right in that moment. Is your job, would you say it's like more stressful than it usually is? Is it about the same for you? What's it been like this past month or so for you and just for other healthcare workers in that similar setting?
Yeah, I'd say there's definitely kind of an extra layer of stress, even though the volumes feel like it's, a little bit lower. The patients that you see, oftentimes they're much sicker, and you're also trying to, navigate the emergency department, and all this extra stuff. We always wash our hands frequently in the emergency department, but now it's like, overwhelmingly amount of time we're spending washing our hands, putting on protective gear, taking off protective gear. A patient that would usually take 10 or 15 minutes to see now takes half an hour because, you're in the room, they can't hear you through the mask, or, it's just a lot more work. And then when they're, especially sick, patients who might need, a breathing tube or CPR or something like that, imagine that with all this extra stuff on you, it just makes it that much more of a production and that much more difficult to get your job done. So there's that whole extra layer of things, right? And then there's also that extra layer of, I don't want to bring this home to my family, the nurses and ER techs and, janitorial staff and physicians, you have that in the back of your head all the time. Like you have to be really careful with, we use the word donning and doffing, which is, putting on and taking off your protective gear. So you have to be really careful with that. You don't want to get sick and, get your family sick and spread it around. And so there's that whole extra layer of things too. So there's a little extra layer of stress involved. But overall, I'd say, my hospital specifically has done an amazing job keeping us staffed with, or keeping us stocked with good personal protective equipment. And really doing everything they possibly can to keep the staff safe. So I've been lucky.
Cool.
I don't, that's not the case for everyone. I've been reading reports that, there's a lot of shortages in other places. And
Right. Yeah, that's what I've heard too. And that's kind of something that I think a lot of people don't, or may not have realized so much. Is you mentioned like you're not wanting to bring this home for your family. Like, what does the past month look like for you personally? Like when you go home, has it affected the way you interact with your family?
yeah, it definitely has. I mean, I have a 5-year-old and a 5-month-old, and kids don't. Thankfully, that's the only blessing of this coronavirus is kids don't tend to get super sick from this. Very, very few kids have died from coronavirus. But you don't want to give it to your spouse either, and kids can still be a vector to go from one to the, give it to my son, who could then give it to my wife. And so it's been pretty challenging. There's been a lot of my colleagues have kind of moved out of their house for the foreseeable future.
Wow.
Moved to hotels or other apartments. That'd be a little much for me, just to be gone indefinitely.
Yeah. So they're just full on just living away from their family altogether.
Yeah. There's a lot of people who do that. We've kind of taken a kind of halfway approach where, I've kind of taken over the master bedroom. Sorry, honey. So I took over the master bedroom and bathroom, and I just kind of live in here and can kind of move about freely in here. But when I'm in the common spaces, I kind of practice social distancing around my family. So I wear a mask. And
you wear a mask inside your house?
Yeah. I wear a mask inside my house. I wash my hands all the time, hand sanitizer all the time. I don't pick up the kids, so that's been a little bit tough. But there's still other things I can do around the house safely and help out. So, but it's been tough. Imagine it's tough for my wife. It's kind of like single parenting almost.
Yeah, because you're pretty much having to quarantine. You're having to quarantine yourself basically in your own house, in your own bedroom most of the time.
Right. And then we had this, and that's just in case I got, an asymptomatic infection at work or something. We have a whole separate plan for if I actually became symptomatic. It would be like, actually, my wife's going to nail the bedroom door shut. Like pass food through a slit in the door or something, if I'm lucky. So, so that's what we're really hoping doesn't happen. But
yeah, Doc, can't you get like the antibodies test? So then if you find out you were sick, aren't you immune to it?
That's where the science is pointing. There was some concern at the beginning that you could get reinfected, and I think we're mostly putting that idea to rest. That's probably not true. However, it's still, I don't think, 100%. And so the idea, though, is like most viruses, if you catch it once, then you're at least immune for a period of time until that virus mutates and, then your body doesn't recognize it anymore and you can get sick again. That's how you get the cold, every year kind of, because immunity from those little viruses like the cold lasts a year and a half, and then you're not protected anymore. So they're kind of hoping the coronavirus is similar, and that's what it's looking like.
So that's good. But on that same train, do we need to be worried about like a second wave coming? Like if we kind of go back to work, is this going to all just go round 2 in like 6 months?
Yeah, potentially so. And I think that's one of the things that they're really kind of targeting the fall, this coming fall as a possible resurgence. Although they don't know if we open up all the way, if the resurgence could happen immediately. So we don't know exactly what a second wave would look like. We know that in the 1918 pandemic, influenza pandemic, there was a big second wave. It hit them hard. But then at that time, they also didn't have the same, they didn't have the same kind of medical technology and knowledge about virology and that we have now. So we don't know necessarily what a big second wave would look like, but almost certainly there will be an uptick in infections once we start to kind of open things up again. Almost certainly. Just don't know how big it's going to look like, especially if we kind of practice some form of social distancing and wearing masks in public and that kind of thing.
Yeah. Okay. In general, has the amount of cases that they were expecting been lower?
I don't know about that. Initially, that's one of the challenges about modeling, right? And that's what all of this is based on, is a bunch of scientists, get together and they plug in a bunch of data and inputs to kind of spit out some kind of output. And they can only use the data that they have available to them. And so all that data was from the initial infections in China. And we don't know how accurate that data is. And so that modeling changes all the time. And some of that initial modeling was built on that initial data and said, hey, if we don't practice social distancing stuff, you could be up to 2 million deaths in the United States, and, really scary numbers. And with social distancing, we still expect, 200,000 to 300,000 dead. And that's what some of those early projections were looking like. And that's based on the best information they had. But I think, as we get more information, it's looking less like 300,000 and maybe more like 100,000, and that's still a horrific number, but at least not the catastrophic numbers like 2 million that we were hearing initially.
Yeah, because one of the things people said initially was like, it seemed like the people who were uninformed were saying, this is going to be just like the flu. What's the difference between the flu and this? And now, though, it's seeming, well, maybe this is just kind of more like a bad flu year. Is that still the case, or are they not really comparable still?
Again, I think we have to realize that the numbers that we're seeing are with us having these kind of draconian measures in place.
Right.
So it's not like this is what it would have looked like if we had done nothing. Like if we had done nothing and just lived our lives like we usually did, the numbers could have been catastrophic, right? And not like a regular, bad flu season. Right? If our numbers do end up looking just like a regular bad flu season, that's more of a testament to what everybody's done by staying home and, allowing the healthcare system to kind of build themselves up and get ready for all of these patients. That's really a testament to that. It's not saying that the virus itself is bad or isn't as bad, right?
Wow.
The virus itself, if we'd have done nothing, could have killed a lot more people.
Wow.
So I think we have to remember that, because that's where all the conspiracy theories and that kind of stuff starts to creep in, as you see these numbers not looking as bad as people were projecting and thinking that that's a characteristic of the virus itself, when in actuality, it's a testament to all the hard work that, public health officials and everybody else have been doing to try to keep the thing at bay. So.
That's such a good point, and I've never thought about that, but I think that goes into why I personally have been feeling like, man, I think I overestimated personally how big of a deal this was. Like, not even as many people were dying as they projected. And but you're right. I never thought about the fact that a lot of that is because of the fact that we were social distancing. And if I stop doing that, that the outcome may be, quite a lot different.
Right.
That's really interesting, man. Did you hear? So I heard this crazy thing out of China. One of the crazy things is that China has not been forthcoming at all about their actual data, right? But did you hear that, like, it was something between like January and February or something? They have like pretty much one centralized cell phone provider in China, and they said that there were like 21 million decreased subscribers to this cell phone plan.
What?
Between like January and February. And like the people who are analyzing this stuff are like, why would 21 million people suddenly cancel their cell phone?
Yeah.
And like they're like sort of theorizing that it's because that's how many people died.
That would be insane. I don't know, man. That's probably that. I've heard all kinds of stuff like that, like trying to figure out how many people have died based on how many urns that the funeral homes ordered.
Right, right. Yes, dude.
Or like how many cell phone plans got canceled.
Right.
It's like, and that's part of the problem is we just don't know how much we can trust the data, coming out of China. And so because they tend to be more, hold that stuff, close to their chest, it leaves them open to, us totally theorizing about
Right.
crazy numbers of deaths or infections and things like that,
True.
So, yeah.
So the last like question I want to ask is, and this one's like a bit more esoteric, but people are talking now about how like we need to be like, what are we going to do when this happens the next time?
Mm-hmm.
And obviously being prepared and being ready for this type of crisis is good, but isn't it true that the last time this happened was literally like 100 years ago, and that this type of thing isn't something that is going to be happening like every few years?
So that's an interesting question. So I think the 1918 influenza pandemic, I agree that in terms of something of this magnitude, a global pandemic like this, that's probably the best thing to compare it to, right? And so something like this, yeah, that makes a lot of sense to compare it to something like the 1918 flu pandemic. Widespread, lots of deaths, lots of morbidity, and kind of this generalized just anxiety in society about catching this thing, right? That being said, we've had tons of close calls, right, since 1918.
Wow.
In the last 20 years, we've had SARS. I don't remember if you remember SARS back in like 2003. That was a type of coronavirus. The name of this current coronavirus is actually SARS-CoV-2 is the official name, the designation. So it's a type of SARS virus. And that SARS virus in 2003 had the had the capability of doing the same thing. They just caught it in time, right? So that was a close call. We've had one from the Middle East called MERS virus, also a type of coronavirus, that had the potential of doing the same thing. A few years ago, we had the Ebola scare. I don't know if you remember Ebola. We had cases of Ebola in the United States for the first time in history with community spread of Ebola. And I would say in terms of preparation, the public health system was doing a really similar thing as they were doing to coronavirus. Really scared about Ebola doing something like this, right? And that would have been way more disastrous than coronavirus if Ebola went widespread. I mean, that is a way higher death rate than coronavirus would be. And so in 2009, there was a flu pandemic that killed lots and lots of people. So I would say, yes, you can look back 100 years ago as a good comparison of what this current pandemic is like, but you could never say that this isn't going to happen again for, another 100 years. We've had close calls, every few years for the last 20 years,
Wow.
and with different types of viruses. So I think public health systems, they have to be vigilant. They have to always be prepared for something like this happening. And otherwise it's something like this could happen at any time. Could have the same thing happen next year for all we know. We just don't know when something like this is going to hit.
Wow. All right. And just for the general population like me who don't really know anything about the public health system or like even really what that is, or I mean like what they do.
Yeah.
I mean, how has ours responded to all of this based off of what you've seen?
I think they've done, what they can in this situation. I think we've had, a general concern about the lack of personal protective equipment. And I think that public health, that's not necessarily their sole responsibility, but it's a general kind of United States public health awakening, I think, in terms of preparation for something like an airborne transmittable disease or droplet transmittable disease like this. And the fact that we didn't have enough stockpile to feel safe taking care of these patients, and that's a problem. And I hope moving forward, they realize that and realize that they have to be stocked and ready for something like this at all times. It would be a very small amount of the U.S. budget to be prepared for something like this. And I think one of the major functions of government would be to be prepared for something like this, right? Something that has the potential for widespread disaster. So so hopefully it's a wake-up call. It's a not necessarily a wake-up call because it actually happened, but hopefully it's an opportunity to learn for the public health system and for hospital systems in general, to be more prepared in the future.
Okay, that's helpful, and that's good to know. How about a vaccine? Any news on when that might happen from what you've heard?
I've heard there's multiple companies and kind of academic institutions trying to develop a vaccine. I was reading one out of like Oxford that is way ahead of the curve on everyone else developing a vaccine because they kind of were already working on one or something before this whole thing hit, a general coronavirus type vaccine.
Wow.
And so they had already proven some of the key safety things for vaccines. So, there's some optimistic stuff coming out of there that you could potentially get a vaccine in September, trials at least, that kind of thing, which would be incredibly fast for a new vaccine. Like that would be insane. So, but that's all still, in development. I've heard other sources saying we may not get a vaccine for like 18 months. And then other sources saying this thing mutates so quickly that maybe we won't be able to make an effective vaccine. So, so I've seen it all over from very optimistic to very pessimistic, and I think it's probably still a little too early.
Okay.
Yeah.
All right, man. Well, any last thoughts or anything that you feel like would be helpful for the public to know that we haven't gone over yet or that we haven't covered?
One of the main things I'd say is I know it's been super hard for almost, everybody in the United States, whether you're a healthcare worker or just someone that's trying to be at home, like you've lost your job or have to go on unemployment, or your family life is super stressful because your kid's at home, or you're trying to teach homeschool your kids. I know your last podcast was like really helpful for parents with that kind of thing, Jonny. So I think with all of that, I think everyone should kind of feel that as hard as it is, like you actually are in a very small, it may feel very small to you, but putting it all together as one huge population of people who actually are making a difference. I think this could have looked way worse than it actually did. And it's because, like, almost unquestioningly, the whole population of the United States was like, yeah, let's protect each other. And we know very little about this virus, but we know that we have to be in close contact to pass it on. Let's lock down. And I feel like people should, take a little bit of pride that our country and our population was able to do that so quickly and effectively. I think it made a huge difference. So that's the first thing is, feel good about, what you've done to help, stem the flow or the spread of the virus. And the other thing I would just say is, for people who are having a really tough time, I know we see a lot of people who are having, tough time with depression or thoughts of suicide, that kind of thing, because they've lost their job or they, feel isolated, that kind of thing. There are a lot of resources out there. Please reach out. If you're feeling really bad, go to your emergency department. We can help with that kind of thing. And don't ignore it and don't feel alone. I think those would be some of my biggest pieces of advice.
That's awesome, man. That's really helpful. And I'm glad you said that because some of these things that we're doing really are affecting our lives, like not working, not seeing our friends, feeling isolated. But it is a consolation to feel like it's worth it.
Yeah.
And feel like what we're doing is not for no reason. And it doesn't necessarily make it easier, but it does make it a little more palatable to have these things affect our lives in that way. And so that's really cool to hear from you who know quite a lot about this and who have seen it firsthand, that you feel like it's really making a big difference.
Yeah, I definitely think it has. Yeah. So thank you, everybody. Thanks for staying.
Hey, awesome. Cool. Well, Doc, thanks for joining me today. I really appreciate it. I'm really glad to get this information, and it's been an encouragement to me. I want to encourage everybody else out there to keep it up. And if you know somebody who may be struggling, to reach out. It's pretty cool, man, to see how people are doing these, Zoom calls with their friends, happy hours. And when I saw my first friends doing that, like having drinks together at 5 over Zoom, like it was pretty funny to me. It seemed a
Yeah.
little bit strange, but that's now like a common thing that everybody does.
Yeah, it's just normal life. I wish I would have invested in Zoom stock like in December.
I know. Did you hear there was a company that their trading symbol was Zoom, ZOOM, but they weren't the actual Zoom company that everybody bought? So
Yeah,
it's like this company spiked even though they had nothing to do with video messaging, and then it like totally messed up the whole trading stock for this company. But
that
um,
CEO was stoked though, I'm sure.
yeah, I know. But then somehow they had to give the stocks back or something. I don't really can't really remember, but all right, everybody. Hey, thanks for tuning in. If you made it this far, appreciate you, grateful for you, and we will catch you next time. Bye.